عليكم. في البدء نترحم على شهداء ثورة ديسمبر وكل شهداء الحراك الثوري في السودان، وعاجل الشفاء للجرحى والعودة الميمونة للمفقودين. As introduced by Madam Chair, my name is Elfatih Abdelraheem. I am the Regional Health Advisor for UNDP Regional Office in Istanbul, covering Arab states. I am also a blockchain strategist, certified strategist from Oxford University. And this is humble effort is an attempt to regulate the health and essential medical supplies in Sudan. So in terms of what is the current structures and systems of the health supply chain management systems in low and middle income countries, and then the rationale, why do we need to introduce this new digital innovation in the world of in the world of supply chain, excuse me, and how it will be relevant to achieve the Sustainable Development Goals, not only SDG 3 but others as well. And then very quickly we'll skim through some of the features and structures of the proposed system, and also what is the needed regulatory framework, because the current regulatory framework is not conducive for implementation of this system. And we'll conclude with some recommendations and hopefully a roadmap. So if we look to the current health supply chain management systems, not only in Sudan, but in many countries, in low and middle income countries, it is characterized by complex multi-tier system. Usually it has four tiers, between 3 and 4 tiers. So if we take Sudan, for example, you have the central medical stores, which is responsible for purchasing and utilization and also distribution of the health supplies. Then you have the state health authorities, health ministries in this case, and then we have the county or locality in our current federal system, and finally you have the hospitals, and which is, assumingly we can assume the hospitals is a distribution for the end users of the medicines and supplies. This is important to take into consideration because I will explain later how this can contribute to the challenges in terms of forecast and also in terms of distribution. So I will take mainly 3 main challenges of this current system. The first one is the loose accountability. And it is everyone's job and no one job to make sure that these medicines and supplies are well utilized, distributed, and dispensed in the way it has been planned for. Also, the central medical store, which sits at the federal level, doesn't have any authority on the warehousing and the processing that happens at the state or county or locality level. The second main challenge is corruption. And I think in the first weeks of Dr. Akram At-Tom, the new Minister of Health, we have seen him talking to the media how that many of the medicines, essential medicines, were found in the stores and in the warehouses and have not been distributed to the end users in terms of health facilities. And also we have seen how there are records that have been lost, how their inventory of medicines is not matching the actual medicine batches that are in the warehouses. So the corruption is also a serious challenge, not only in Sudan, in so many countries facing the health supply chain. And then based on the complex structure that I have explained in my first slide, the 4-tier system, this creates a complexity resulted in something called the bullwhip effect. You know, the bullwhip effect, اللي هو الصوت بتاع thank you. صوت العنج اللي بيستعملوه بالذات في السيركس بيخوفوا الحيوانات المفترسة. small variation أو small movement in the hand of the trainer will result in very massive change at the end of the whip. So what do we mean here? If there have been a very small variation in terms of forecast or the quantities of medicines produced at the end user, which is a patient, when it passes all the way to the manufacturer, it results in huge variation or leap. This can lead to production of unnecessarily massive production that can further lead to waste. because that is happening because we don't have a system that allow a real-time data about the stock, where it sits, and the consumption. So very quickly again, what is blockchain? Or its other name is the distributed ledger technology, DLT. blockchain ممكن كلكم تكونوا سمعتوا بالبيتكوين. The blockchain is the technology that power and enable the Bitcoin exchange. Simply, it is a distributed cloud-based network. Distributed means that most of the current databases are centralized in a computer or a laptop or whatever, while the distributed network is distributed among so many devices. Cloud-based, I think, explains itself, and it provides very important features that is secure, immutable, and trusted platform for exchange of values. And these values doesn't have to be only money, anything of value, including medical records or supply chain records. So before we go into, if we need to understand is a blockchain a solution for the challenges that I have explained earlier, we have to answer a bit of a question. And here I'm referring to what is called Oxford, University of Oxford framework for assessing whether blockchain could be a solution for any system. So the first thing is there a predictable, repeatable process that lends itself into an automation? And I think here clearly the process of purchasing, distribution, and dispensing medicines is a regular and continuous process, and it is at a scale. So this means that the answer here is yes. And there's usually a long-running transaction that happens more than once. Usually once every 2 years or once every year, depends on the country, from one country to another. And there are multiple stakeholders involved in the process, as I will explain later. These details will be in the presentation. I will not go through them. I just want to demonstrate how it is not any problem can be solved by a blockchain. But there are certain criteria that need to be met before blockchain could be proposed. So the health chain and the relevance to SDGs, and I think this has been the main theme of this conference. So I tried here to illustrate some of the relationship between some of the sustainable development goals. Obviously, SDG 3, which is ensure health lives for all, is very closely linked. And here, because SDG 3, most of the targets under SDG 3 depends on very strong health systems. And in the WHO definition or building blocks of health systems comes the access to essential medicines and health technologies. And to be able to access these medicines and technologies, you really need to have very strong health supply chain management system that is the backbone of this health system. But it's not only SDG 3, it's also SDG 10, reducing inequalities. And here I think it's important to understand that the health chain would allow for equal distribution of medicines based on need, not based on demand. Why? Because it will provide real-time data, and this real-time data will help the policymakers to monitor the consumption as it is happening. So if, for example, the stock of insulin in United States is reducing rapidly, while the consumption is going in the same way on Blue Nile states, it is easy to replenish some of the stock in the United States from Blue Nile states. And all of these transactions will be powered through the system, and it will be also recorded. So this will provide some sort of equity. SDG 13, 16, and 17. For 13, which is sustainability and climate action, as I will explain in the next slide, the manufacturers who are involved in the production of medicines and health supplies will be closely monitored because they have the ability to, thank you. The system will introduce the ability to see their manufacturing processes and how they are contributing to the carbon footprint and their environmental sustainability practices as well. SDG 16, it allows collaboration, between various institutions from the global north and global south. So this is also essential feature. So very quickly, so the basic structure of the development stack. The development stack is the definition of the system. So it's composed of three main layers. The foundational protocol layer. This is the foundation, which means basically this is the IT language, the programmatic language that provides the algorithm that governs the transactions of the system. And then the network layer, and the network basically is who are the stakeholders involved in the process and what are the relations between them. And then the application layer, and the application layer is the interface layer. Basically, it is normal, similar to our applications that we use in our smartphones, but this will be called DApps, which is decentralized applications, because they will be based on a decentralized network. I will not go into the details of each. This diagram just demonstrates who are the stakeholders along the development stack. So at the protocol layer, you will find usually academia and researchers, developers, global think tanks, global tech giants. Those are the stakeholders around the protocol layer. And if you have heard, usually in the IT world, there is something called open source projects. Open source projects, when you want to have like very affordable but also accessible to everyone, you establish an open source, and the developers from all over the world contribute to the building or to the contribute to this program language. So this also fosters collaboration. At the network layer, usually you have the people who are defined, and here we're talking about transporters, customs, manufacturers, custom clearance, state level dispensers, and so on. And at the application layer, you can also use the private sector entrepreneurs and end users who are dispatchers. This ecosystem map demonstrates who are the stakeholders along each of the layers. Who are they? What is the role? And what is the motivation? What motivates them to be part of this? And I will just mention one from each. So, for example, developers as a protocol layer. Their role, of course, is to set the protocol map and to update it and to fix the glitches. And their motivations could be either financial or just intellectual curiosity, as when it's an open source project. At the network level, you have the exchanger traders. In this case, will be the CMS staff, Central Medical Store staff. And the role is to facilitate transactions in the chain and validate the transactions in the chain. And their motivation, of course, this is their job, so they need to ensure smooth processing and profit. Similar also at the application level. As I mentioned, there is a need to have an updated regulatory framework. The current regulations, and this is not only in Sudan, even globally, the digital technology is moving at a pace that is the regulatory systems in most of the countries, in most of the regions, is not able to catch with. And the problem is that the current regulations are based on articles. It's very rigid. Article number 13 talks about this and that, and this doesn't really fit the innovation that goes with the fast-moving technology. So the proposed regulatory framework is not to focus on specific articles, but to focus on outcome. For example, the outcome is to have equitable access to medicines and health supplies, and the behavior should be aligned with this, not to be just rigid articles. It also should, the principles should include stakeholders protection, building fostering trust, balanced competition, so no monopoly, and the principles also should promote innovation and respond to crisis, and to be independent from any other any conflicts of interest. So this is also kind of a proposed framework for regulation, not to have just a law or an article or an act to govern this system. And finally, and I have written recommendations that I will hand over as have been advised, but this is just a proposal for a way forward, which is basically if there is an appetite and interest from the officials to apply this system, it could start with a small pilot phase that will help establish the proof of concept, as we call it, and this can happen in one quarter, like Q1 of 2020. Then during Q2, 3, and 4 of 2020, it will be the development of protocols, building of the network, and development of regulatory framework. And then Sudan is a very big and diverse country. The states are not the same, so my advice is to start with a pilot phase that run few and dummy transactions between the federal level, Central Medical Store at the federal level, and some of the states, like you can select one from each zones, and then fix the glitches, do the training, development of the SOPs, and so on. Thank you.
Thank you, Dr. Elfatih. بنحلم بفضاء أوسع، بنحلم بزمن أجمل، بلاد ميلاد، بلاد ميلاد.